Hello everyone, my name is Jen Nolan and I'm the Policy and Programs Manager at Musculoskeletal Australia. I'm also leading the Active Neighbourhoods for Older Australians project at the moment. And I'd like to warmly welcome you to our webinar today on strategies to stay connected and support wellbeing among older people during COVID-19. Professor Ben Smith, our member of the project team, will be presenting, and also Darshini Pereira from Blacktown City Council will also be speaking today. So hopefully you'll have a chance to look through our Musculoskeletal Australia website, where we have a range of information and resources and lots of good videos. Not only would you as staff be interested in these videos, but also lots of your members attending your houses. So it would be great if you could let them know about the resources that are available. Also at the moment, we've got a national consumer survey that is available, and we're hoping lots of people will respond to this. I know lots of neighbourhood houses have actually promoted it to their communities, so we urge people to go to our website and to respond to the consumer survey, which is available and open until mid-October. So without further ado, I'd like to hand proceedings over to Professor Ben Smith, who will be leading us through the main presentation today. Thanks very much, Ben.
Thank you, Jen, and good morning, everyone. I'm very happy to have the opportunity to be presenting today on this topic, which I think is attracting interest because it's relevant to the kinds of challenges that many in the community services sector have been facing during COVID-19. And that concerns how we maintain contact with the communities that we work with under various kinds of conditions, and how we can respond to the kinds of needs that have emerged during the COVID-19 pandemic. I'm presenting to you from Sydney, and I have a position where I work for the University of Sydney in the Western Sydney region. And in my work, I am involved in working with health services and community services providers in the development of their prevention and community support programs. And so I'm very happy to be sharing with you some insights that have been gained from program providers, not only in Western Sydney, but in Victoria and other parts of the country, and also from the wider literature that we've been looking at in regard to ways that we can provide support to older people, particularly using remote methods that don't involve face-to-face contact, and that often will incorporate a health promotion component. So the presentation that I'm delivering now is something that I've developed together with Marianne Kearney, who works with me at the University of Sydney. You've no doubt seen that the social impacts of COVID-19 have been very prominent in the public discussion about the impact that this illness has had in Australia. And that's been great. I mean, we've recognised that obviously there's a physical health risk and a very serious risk for older people, as we know. But we've also appreciated from the beginning that the kinds of control methods that we've been putting in place are going to have consequences, quite significant impacts for people. So, just looking at some of the things that have been brought into public discussion in recent times, I've put up there an image from a major article that was in the Good Weekend a couple of weeks ago. That's the Age and Sydney Morning Herald Good Weekend, which is headed, the world's greatest psychological experiment, when the loneliness epidemic met the coronavirus epidemic. We've had editorials and commentaries that have been written in journals, and I've got a couple of headings there. One, older people in COVID-19, isolation, risk and ageism. Another one, how the COVID-19 pandemic is focusing attention on loneliness and social isolation. And then just this week, some of you might have seen on the Q&A program on the ABC on Monday night, the age of loneliness was the topic, and discussion was around how COVID-19 has brought issues of social isolation and loneliness to public awareness, and was an environment where we could consider the kinds of strategies that we might put in place. And I imagine that you as neighbourhood centres and organisations as grassroots groups that are in contact with your communities are seeing these kinds of things in various ways on a day-to-day basis. The Australian Bureau of Statistics has been conducting a household survey of the impacts of COVID-19 from earlier on in the year. And this slide that you can see here shows you findings from the April and May survey when people were asked what were the major sorts of stresses that they were experiencing. And in this figure, the blue bars represent people aged between 18 and 64 years, and the light green bars represent people 65 years and over. So you'll see over on the right-hand side, suffering loneliness was the number one thing that people reported as the stressor that they experienced. So what the ABS survey has shown is something that's pretty consistent with what frontline providers have been saying, talking particularly about Lifeline and Beyond Blue and other organisations that are providing direct support by telephone and other methods. And they've been seeing a dramatic escalation in the numbers of calls that they've received from people who are experiencing anxiety, struggling with feelings of isolation and loneliness. And I think that obviously the fact that older people, particularly who are more at risk of COVID infection, have had their worlds reduced in terms of the ability for them to get out and about. The risks attached to going to different programs have increased. As a result of that, people that might have been living alone are experiencing their isolation in an even more acute way because they just don't have the kind of opportunities that they've had in the past to maintain contact with other people. While at the same time experiencing a number of challenges in terms of their anxieties and the vulnerabilities that they experience in relation to infection by COVID. So this has been a major part of the experience, and what we see as the consequences of that, I think, are increases in anxiety and depression. We see a loss of opportunities to engage in physical activity and to be involved in different kinds of programs and groups that people would normally have been attending. Associated with that is reduced opportunities for mental stimulation that people get through participation in activities and maintaining contact with others. We're seeing reports of people attending their health services less, and I think also being less connected to support services that they would have used in the past. And I think as a result of that, and also the kind of mental health strains that people experience, we've I think being confronted by prospects that people are going to be experiencing, greater long-term health risks as a result of not being in contact with the usual supports they receive. So this, I think, raises questions for major providers of community support and community capacity building, such as neighbourhood houses and centres, which are possibly the most widely based grassroots organisations in the country that are in contact with communities. Organisations that are possibly more in touch with the needs of grassroots communities than any other service provider in the country, if you think about neighbourhood houses and centres as a sector. And the kinds of questions that arise in this context of greater isolation and strain for older people is what strategies can houses and centres use to promote wellbeing and social connection for older people during COVID-19? And is it possible that insights and learning can be gained from innovations and adaptations that are made in this environment that can assist program delivery in the future? So these are the questions that we've been exploring, and this has been work that's been done within the Active Neighbourhoods for Older Australians project because this program has been affected by significant disruption. We've been set out and funded to support neighbourhood houses and centres to develop new physical activity opportunities for older people and to find ways of reaching and engaging isolated and more disadvantaged older people. And then the whole program was dramatically affected by COVID-19, and we had to stop and consider, well, how can we provide kind of useful support? What can we do in this environment to adapt and to continue to work with neighbourhood houses and centres? And one of the things that we saw that we could do was to have a look at the kinds of strategies that neighbourhood houses and centres might use that don't involve direct face-to-face contact, that don't involve bringing together people in groups, which promote wellbeing and social connection. So that's the work that I'm talking to you about this morning. And the steps that we've taken to learn about this and to gather insights about these kinds of possibilities have been firstly to conduct a literature search, focusing particularly on remote social support strategies. So I'm using that phrase, and what it was referring to is non-face-to-face contacts that might be through phone, through text message, of course through the internet, through social media, through video, etc. Focusing particularly on older people and looking at what kinds of impacts these sorts of strategies have achieved and what have been found to be success factors. And then the other thing that we've done is we've reached out to neighbourhood houses and centres to hear from them about the kinds of innovations they've put in place, new kinds of ways they've been trialling the delivery of their programs, to see what they've been doing and what kind of creative work has been done and what's been learned from that as well. So turning firstly to the literature review that we conducted, I have to say we're a little bit surprised. There's been a lot of awareness about the issues of loneliness and isolation among older people and the mental health and health consequences of that. And so we thought that there would be a fair bit of evidence concerning the kinds of non-face-to-face strategies that might be used. And really what we found was very little. There's been a lot of different types of programs that have involved, group provision, different types of activities, one-to-one counselling, use of peer support workers, etc., etc. But they've all been face-to-face in nature. When we went looking for non-face-to-face strategies, we found far less. In fact, we found 12 examples that were reported in either the peer-reviewed literature that is in journals or in reports, in the case of one program that was available online. Looking at where that evidence came from, it was pretty widely distributed. Three of the reports came from Australia, 3 from the United Kingdom, a couple from Holland, 1 from the United States, others from South Africa, Norway, and Taiwan. We found that there were 6 quite rigorous evaluations where there was a control group, 1 where they used a pre and post design, and 5 other evaluations which used interviews and focus groups and surveys and other mixed method or qualitative approach. Not all of the examples actually described specifically which groups they were providing for, the programs for, but 6 of them said they were providing these supports for older people living at home, 3 were providing them for people living in aged care, and the age range averaged sort of between 65 and 75. Obviously, it was across a wider range, but participants on average tended to be between 64 and 74 years of age. So across these 12 articles and reports that we collected, we found examples of the following kinds of strategies. Found that several projects were delivering health advice and health promotion support through methods such as video and telephone, also wanting to reduce isolation. So they're in effect providing a health support program that was also a way of maintaining contact with people and having sort of a clear kind of meaningful purpose for that contact, other than just keeping up with the person for social reasons. And some of them also had a health monitoring component where the person was required to monitor different aspects of their health. We found there were 2 programs that were using group chat facilities. So they were encouraging people to connect with others via WhatsApp, video, and other kinds of methods. 3 were using video calling. 4 were under the heading of general befriending kinds of approaches. That's usually where just a phone call is made by a community staff member or a volunteer just to check in with the person, see how they're going. And 1 which was based in a men's shed, which was where an online platform had been created, which enabled the men to continue to interact with each other outside of the house itself or the shed. The services that the people that were delivering these services included nurses and health staff, included volunteers, and included workers within aged care facilities and community organisations. So just looking at the findings, most of these examples reported on changes in loneliness or isolation, and a number of them also reported on levels of depression and mental well-being. In these examples that we were able to collect, most of them showed positive impact, with the exception of the telephone befriending initiatives. That they were the ones that stood out as providing less evidence of clear impact upon levels of loneliness or mental well-being. Looking at this kind of diverse range of strategies, we saw that projects that used a variety of different kinds of information and communication and technology approaches that appeared to be a little bit more successful. So diversity of delivery method, across video, WhatsApp, maybe even telephone, combining those different types of approaches seemed to improve their impact. And we found that there was programs that were providing contact on a weekly or a bi-monthly or fortnightly basis were effective, but one of the limitations that was noted there was the availability of the service or the family to provide that kind of regular contact. But those that were bi-directional, which means that the community member could contact the support service via WhatsApp or text or phone, so that there was a responsiveness, tended to be quite successful. So having the opportunity for 2-way initiation in this process was a beneficial thing. Several of the strategies were looking at ways to facilitate contact between the older people and others in their social network. So trying to equip older people with familiarity with technology that they could use to stay in touch with family or friends or members of men's sheds. That was found to be beneficial. And in several of the examples, there was training of staff members from the organisations or volunteers to be people that would then go and contact older people to train those older people and how they could use Skype or WhatsApp or other kinds of technology. So that kind of model of equipping staff and volunteers to then be able to train older people in using ICT was used a bit and found to be beneficial. And lastly, one thing that we noted looking at all of the examples that we collected was that there was actually very little evidence of any kind of consultation with older people in the design of these programs or any kind of co-design strategies. So it seemed to us that was, in a couple of the reports that we collected, there was note made of that there needed to be more attention to working collaboratively with older people in the design of these sorts of strategies and adapting strategies with input from older people. So that's what we found from our examination of literature and reports. I just want to finish up now with a couple of examples of things that we've heard about that have been done in neighbourhood houses and centres. And in a little while, Darshini Pereira from Blacktown City Council is going to be describing the work that they've been doing in collaboration with the Woodcroft Neighbourhood Centre. But just to give you a bit of a sense of the kinds of things that have been done, some innovative strategies. We've spoken to staff from the Leopold Community Centre, and they've talked to us about a tech tea room that they've set up, which is where they've trained older people through one-to-one sessions in how they can use devices like iPads so that they can then, through those iPads, participate in Zoom rooms where they can be in contact with neighbourhood house members and others in the community. And they've also been promoting that through their newsletter and also putting out stories about the kinds of experiences that people are having when using that opportunity. And some of the other things that Leopold's been doing are shown on the next slide. And that's included setting up an art room via Facebook, hot chocolate book club, and also setting up Zoom Zumba sessions as a way of providing physical activity support and encouragement for participants. Another example that we've heard about, and I'll play a short video which just illustrates this, is a cultural dance initiative that Belgium Avenue Neighbourhood Centre has been using. And this short clip, which will run for a minute, will show you what this has involved.
Nhân gian xem hội trăng tròn, trăng tròn 16 thật to, người ta đi đứng thật đông. Đêm nay là hội trăng tròn, em đi xem hội trăng tròn, áo quần hai gấm bận bao.
That's just a short clip to show you what they've been doing at the Belgium Avenue Neighbourhood Centre, which I think is a creative way of offering something that's a bit novel as a physical activity opportunity for older people. And we've heard about similar kinds of things that have been done in other parts of the country. So that gives you a couple of examples just to wrap this up and share some of the lessons that have been learned. And what I'd like to invite you to do in the chat window is to include any kinds of innovative new things that you've been trying at your neighbourhood house and centre as a way of promoting wellbeing and social connection for older people. So I'll invite you to just, just in dot point style, add in any kinds of examples of things, because it'd be great for other people to hear about those while we're together in this webinar. So just to move back to the last slide and highlighting a few lessons that have been learnt, that providing a variety of activities, not just exercise, but also art, group discussion, is a way of keeping contact with a broader range of older people. Looking for things that are novel, such as the cultural dance that I've just shown you, and fun, and Darshini will tell you a little bit about things that have been going on at Blacktown, is a way of making it more attractive for participants. And also we've heard from particularly the Leopold Centre that they found that engaging young people who have really good tech skills is helpful, because they can tap into those, and also they can get some creative ideas, and also are looking, ways to involve bilingual workers who can also bring in an understanding of different kinds of culturally appropriate and interesting activities that can be built into programs.
Thanks very much, Ben. That was very interesting to think, and to hear what you had to say, particularly about the literature and also that example from Belgium Avenue and also the Leopold House. It's certainly interesting to sort of think about, and I know there's many neighbourhood houses within the Active Neighbourhoods for Older Australians program that have done a great job of transitioning from a face-to-face situation to a more of an online sort of program delivery. And it's interesting that thing about obviously even the issues around availability of iPads or laptops or phones and so on may be an issue for some people. But the idea of actually training older people, and maybe many neighbourhood houses are already doing this, of providing sort of sessions where they increase older people's knowledge of information and communication technology. There's actually a question that has come through in relation to, is there support or support people on how to set up IT for remote connection? I mean, I don't know if you know of anything or any services available that can. I know a lot of local libraries provide a lot of information about certainly increasing the knowledge of older people around the use of IT. Are you aware of any sort of other services out there to maybe assist neighbourhood houses in increasing their sort of IT capacity?
Well, that's why some of the organisations were reporting that they use young people, that there's a group in the community who are very savvy with technology, and if you can find those who are willing to.
Yeah, so it's interesting, that thing about the idea of training older people to actually improve their IT skills. We've actually had a few comments coming through from people who responded to your question about some of the different strategies that they have put in place. Yarraville Community Centre recently had a craft afternoon. Someone else has been doing drive-bys where they can sort of be within 5-kilometre range. As Sunbury New Neighbourhood House have been engaging in the Be Connected program and so on. So there's quite a few things that are coming through that people have been doing to reach out and reduce the isolation of older people. So I guess the thing is, the other thing that was interesting from the literature was about the two-way initiation with regards to not only the neighbourhood house approaching older people, but older people being able to connect in with the neighbourhood house. Can you comment a bit more on that?
Yeah, that was a finding that came through quite clearly, that that sort of empowerment of the participant that gave them that sort of freedom to reach out and equalise the relationship a little bit, I think, was beneficial, and obviously provided a little bit more frequent contact, but also we think that it contributed to improved mental health as well. So that seems to be a clear finding. I imagine there's a challenge attached to that, though, because if it assumes that there's going to be somebody at the other end of the WhatsApp or the phone or whatever who's available all of the time to respond, then that raises questions about whether that house or centre actually has that capacity. Maybe that's an opportunity for bringing in a network of volunteers who might be able to sort of broaden the support base for people who could be reaching out to centres.
And there's no, as someone makes the comment, there's no doubt it's challenging to try to increase older people's capacity around their use of IT when we can't be at close quarters with them. It's probably something that can certainly be kept in mind for when hopefully more sort of normal circumstances return to even earlier in the new year, if once particularly restrictions in Victoria reduce, and we can then maybe have some more face-to-face time.
That I completely understand that. Interesting though, that if it is possible to engage older people in that learning process, there's lots of confirmation that that's empowering for them. So we just looking at one of the reports, and I'm reading from this that we collected. Older people reported feeling young, becoming one of the modern generation, overcoming challenges, equipping themselves with new skills. So that training and skill development, while I admit is challenging, it can be quite an empowering thing and good for self-esteem.
And interestingly, the Thurgoona Community Centre have said they've had a social club working party of volunteers providing such things as Zoom, virtual coffee and chat, weekly emailing. A team was formed to regularly ring members of the social club. Members of the group have joined in an art project online, participating in Sculptures by the Sea project. You know, I know there's lots of quite innovative ideas that people have been using during this very challenging time. So, Bim, I think that's about all with the comments and questions that have come through for the moment. So, and unless there's further comment from you, I might pass over to Darshini.
Hi.
Thanks very much, Darshini.
Hi.
And welcome.
Thank you, Jen, and thank you, Ben. Thanks for the opportunity to share a bit about our program, the weekly dance class for older people through ANOVA at Woodcroft Neighbourhood Centre here in Blacktown City. Before I begin, I'd like to acknowledge the traditional custodians of the land from where I joined this webinar, the Darug people. I pay my respects to elders past, present, and emerging. Even before we commenced in March 2020, our dance class was very popular with older people who had heard about it through their seniors groups or the Blacktown Seniors Day celebration, a key local event celebrating New South Wales Seniors Festival with over 700 participants. Our dance instructor performed a demo dance at this event, and our sign-up sheet was bursting at the seams with eager participants. When we started classes in March, we had 31 participants, 6 community connectors, and about 15 standby participants who were willing to step into any spots vacated by those who might opt out. Our dance instructor, Ryan Herbert from Move With Me Dance Studios, developed a program that would teach our participants a variety of classes through the year using dance sequences that could be adapted to suit different levels of ability and fitness. Our community connectors were on hand to offer practical support to participants by offering encouragement and guidance to anyone who found it difficult to keep up and helping everyone to feel included. There was a really positive vibe about the classes, as you can see from the photos. The group included female and male participants aged 61 to 90 years of age, represented diverse cultural backgrounds, different types of dance experience. We got through 2 weeks of classes learning to do the waltz with a partner before the COVID-19 pandemic caused us to suspend classes. Needless to say, it was disappointing to have to suspend classes, but the safety and well-being of our older participants was weighing heavily on everyone's minds. Council also closed all community facilities, including the Woodcroft Neighbourhood Centre, a short while later. While classes were suspended, I kept in touch with the participants and community connectors by checking in on how they were coping with the changes brought on by the pandemic. During our conversations, I explored if they'd be interested in dancing at home, if we provided them with a link to an instructional video or a DVD. While they were open to the idea, it was clear that not everyone on our group, in our group, had access to technology or the internet. So we would have to come up with a range of solutions in response to what our participants and community connectors had access to or were willing to try. For some, the phone was their only means of connecting to the outside world, while some had mobile phones. Not everyone with a mobile had access to and the confidence to use apps such as FaceTime, WhatsApp, or Zoom. I encourage those with a mobile or iPad who were willing to learn to use an app to connect with LEAP NGO's TechMate program, where they could have support over the phone or through their iPad to learn how to use Zoom or WhatsApp or FaceTime or anything else they'd like to learn. I matched participants with community connectors based on what technology they had access to enable the community connector to follow up with about 5 to 6 individuals on a regular basis. If there were participants able to use WhatsApp and a community connector also able to use WhatsApp, we matched them that way. So, it helped with the community connectors costs as well in terms of phone calls and things. We had 11 participants from 6 households who were provided with a DVD version of the instructional video as they couldn't access the internet or preferred to practice with the DVD. One of our participants, aged 90, couldn't access the instructional video online. Unfortunately, nor could she use a DVD because she didn't have access to either type of technology. It was clear that the participants, community connectors, Ryan, our instructor, and I were all impacted at various times by health issues or family issues that affected capacity to connect, plan, and support during the lockdown. Participants and community connectors shared that they felt isolated, frustrated, overwhelmed, and concerned about what was going on around them. On the 22nd of July, Council reopened community facilities. Ahead of term 3, I contacted our participants and community connectors to see how they were doing. How did they go with working out regularly with the online instructional video or DVD? And were they interested in participating in a dance class, whether that be online or in person? Their responses indicated that the video was good, but not everyone used it every week. Some said they'd used it a couple of times. A couple of participants had to rely on their grandchildren or adult children to help them to connect, and therefore they couldn't put it on whenever they liked to use it. Ryan and I felt disheartened after all the effort that had been put into getting the video finalized and distributed. Participants and community connectors had different perceptions around what they felt was safe for them in light of what was happening in their lives in New South Wales, in Victoria, and around the world. Many participants fed back that they had only gone out for essential things like medical appointments or to get groceries, and were not going out to socialize, even with the restrictions easing. Some were walking as part of their daily routine, some were exercising at home, but a majority of our participants had no opportunity for regular physical exercise. Most social support programs had ceased. About half of our participants were not comfortable returning to Woodcroft Neighbourhood Centre to exercise, but were open to having access to an instructional video online or via DVD. The remaining half said they'd prefer to return to Woodcroft Neighbourhood Centre to exercise with others because that was more enjoyable than doing it at home alone. They were concerned about mixing with others and wanted to know adequate precautions would be taken to ensure safety. Information was provided to demonstrate that we'll be adhering to Council's COVID-19 agreement and the New South Wales Health Guidelines for community exercise programs, which meant no more than 20 people would be at the class. Things like hand hygiene, social distancing will be followed, and the use of masks when encouraged, as you can see from our photos again. Ryan modified the program he'd set for term 3 to adapt it to the restrictions, teaching a kind of a cha-cha line dance. He also developed an instructional video. So this term we've been able to have 12 participants, 2 community connectors at Woodcroft Neighbourhood Centre on a weekly basis for our classes. It's now our 3rd week, and we're hoping that we can extend that over the holidays to make up for lost time. There are 11 participants and 2 community connectors wanting to follow the instructional video and do that either online or on DVD. We've not had any participants say that they want to drop out of the program. So the learnings for us is that it's all about support and working with people to make it work for them. There is no one-size-fits-all solution. they've adapted. We've adapted our planned program to conform to the current New South Wales health guidelines. We've kept connections going through the pandemic and tried to facilitate exercising from home through our instructional video with phone follow-up. For some who've had things like WhatsApp available, they've been able to connect that way as well and have the video link on the phone as well. People have different priorities and perceptions around safety. Exercising in isolation isn't enjoyable, but when there was no other option available, participants were more willing to try it. Exercising as part of a group is a motivator and is considered more enjoyable by about half the group. We've learned to look for opportunities to do something than do nothing. The phone has been the most effective and has the widest reach within our group during the lockdown to connect with people. It's important to implement a mix of solutions with a mix of new and old technology. That's it from me.
Thanks so much, Darshini, not only for your fantastic sort of presentation just then, but also for what you've been doing. It's great, and I know many staff in neighbourhood houses have been doing this, to really working so hard to find a way around the current circumstances. So the way you've come up with your hybrid sort of model now, I think that's really fantastic, and you've obviously worked so hard to try to meet everyone's needs. There is a question that has come through, and I urge anyone else who'd like to ask a question to put it in the question box now. Darshini, someone sort of said, you know, it all sounds great, and interested to know if your community connectors are volunteers.
Thanks, Jen. Yes, they are. The community connectors were senior group and a pool of volunteers that council.
How many community connectors do you have?
We had 6 before the pandemic. We've lost 2 during the pandemic because one took up caring food, and the other stopped because of health issues and being an older person themselves.
Darshini, there was just one question with regards to the support organisation that was used to help with the technology.
Yeah, Jen, I've shared that on the chat. It's LEAP, and they provide the TechMate program. They're part of the Be Connected network. There are local program that we can tap into. It's a free service. I believe it's available to anyone, you know, regardless of age or. But the beauty of what they offer is it's based on what the person wants to learn. So it's not predetermined. It's you know, you can register a number of times and use it for different purposes. If you might, you know, get into using it to connect with others using an app, or you might want to learn about how to do online banking or how to order your groceries online. You know, just it's really is up to the learner, the user, to work out what they want to learn through there.
I think what Darshini described to us was just an example of some of the really innovative things that have been done during this challenging time, and the learning that has come from that. And I thought it was fascinating to hear about how community connectors have been kind of built into supporting older people in different ways as you've adapted the program. And I also want to mention that in the 4th term of this year, we're going to be reaching out further to hear more from neighbourhood houses about community connectors and how they might be used and what some of the possibilities and some of the challenges might be, so that we can get some insights into the possibilities for that for the future. And also we're going to be reaching out to collect more stories about the kinds of ways that neighbourhood houses and centres have been staying connected or reaching out to a wider range of older people.
But there's no further questions coming through, so we might finish up there. Many thanks, Ben, for your presentation, and also Darshini for your presentation today. It's really fantastic to hear that very local example from a neighbourhood house. So all the very best as you continue your program moving forward. And also well done, and thanks to everyone out there who I know has just been working so hard to keep older people engaged in their physical activity programs, or as a way in reducing their sort of isolation and loneliness during this time. I know Victoria and Queensland are reaching school holidays this week, end of this week, so hopefully everyone will have a nice break, and I think all the other states go on school holidays in another week's time. So look, thanks again everyone for joining the webinar today. Thanks to our presenters, and all the best. Let's hope that things progress positively for all states as we move towards the end of the year. So on that note, have a good day everyone, and we'll be in touch in the future. Thanks and goodbye.